Patients ask me what's the difference between cemented and uncemented hip replacements. So when hip replacements first started 30, 40 plus years ago, they were all cemented in. And cement is a bit like a grout. It kind of, we put it in its liquid form, it takes about 10 minutes, it sets, and essentially fills a space between the implant itself and the patient's bone. And it's great. The only problem is it's got a lifespan. And the lifespan is anywhere between about 10 to 15 years. And unfortunately, it's an interface that fails. And this is why hip implants will fail after 10 to 15 years if they're cemented. Not all of them, some will last longer. But if one is high demand, then we need to be careful because it may not last as long. So what's come from this is uncemented implants. So we don't use this cement. We have an implant that's press fit, so it really has a tight fit. And usually a lot of these have a coating on, and the patient's own bone will grow into and onto this implant. What we find with these implants is that their lifespan is much longer, essentially 20 years, 30 years plus. And this is why we're tending to use these types of implants for younger patients. In terms of outcomes, there's no difference between the two, and this is borne out on national joint registry data.